Hello, good morning, everyone. My name is Shuchran, and today I'm going to give a presentation on cancer treatment and its trends, the current industry, how cancer treatment is going on, and the different methods it's going to go in. Entering to the topic, introduction to the cancer treatment. Cancer is a complex group of diseases with diverse treatment options. Understanding the various treatment methods is essential for patient care. This presentation will explore the current methods and emerging trends in the cancer treatment. Uh, and yeah, the department which deals with the cancer, the medical department, is called oncology department. Uh, so there are different departments such as surgical oncology and the professional oncology department, which deals with the cancer. The surgical oncology department is a department which deals with surgeries, the cancer surgeries which are required with professional surgeons. And yeah, the traditional treatment modalities or methods. The three main traditional modalities are surgery, radiation, and chemotherapy. As I said, surgery aims to remove tumors and surrounding tissues to achieve complete cancer removal. Chemotherapy uses drugs to target and kill rapidly dividing cancer cells throughout the body. And radiation is more like using light and directing it to burn out the cancer cells. The targeted therapy. Targeted therapy invokes drugs which are specifically targeting cancer cell markers. The method aims to minimize damage to healthy cells while maximizing treatment efficiency. Treatments include monoclonal antibodies or small molecule inhibitors. This is this targeted therapy is required to use like chemotherapy because this minimizes the damage to healthy cells, which also gradually improves the patient's health, not decreasing it. Generally, in cancer treatment, the patient cell deteriorates uh, even in treatment because the stress is too much for them to handle and for the body. Their healthy cells deteriorate and their immune system also slowly deteriorates. So this targeted therapy is very helpful in situations like that because it doesn't actually target the healthy cells and does the least amount of damage to healthy cells, only maximizing treatment efficiency. And this also helps in clearly removing the cancer cells from the body. Immunotherapy. Immunotherapy harnesses the body's immune system to fight cancer more effectively. It includes treatments like checkpoint inhibitors, CAR, CAR T cell therapy, and vaccines. This approach has shown promise in treating various cancers, including melanoma and lung cancer. And yeah, immunotherapy refers to something as using the body's natural abilities to create the cancer cells. This requires the ability of vaccines, which generates antibodies in our body, which in turn reproduce and produce more antibodies when we get afflicted or affected with cancer. This immunotherapy is very good and which is also a less stressful uh, therapy compared to the targeted therapy, etc. Because this this works by our body's natural immune system and not by any external influence. So this is a good cancer treatment method. Coming to the hormone therapy is used primarily for cancers that are hormone sensitive, like breast and prostate cancer. This treatment method works by blocking the body's natural hormones or by inhibiting their effects. It can be used alone or in combination with other treatments to improve outcomes. This hormone therapy works like to restrict the access to the of cancer for spreading to the other body parts. Like they said like prostate cancer or breast cancer, they by using the different treatment methods, they block the hormones from spreading out from the spot where the tumor or cancer is formed. Uh, this in using conjunction with or combination with other treatment methods may significantly reduce the cancer, affecting the body less. Coming to the personalized medicine tailors treatment plans on based on the individual genetic profiles. Advances in genomics have allowed for better prediction of treatment response and side effects. This approach aims to provide more effective and less toxic treatment options for parents. Like the personalized medicine, this depended upon the patient's body, like their genetic profiles, the DNA, the blood groups, and the genetic line. Uh, this is more likely not available to middle class people because this is a high cost treatment. They analyze your DNA or genetic structure according to your body and create the targeted specific medicine to harbor to remove the cancer cells from your body. This is structured different for every other person, not same for everyone. This also provides maximum efficiency to remove the cancers, and also has because of it being tailored to our genetic structure, it also has no side effects or not much side effects. And yeah, the current emerging trends and uh, In this, we're talking about biopsies. Liquid biopsies are non-invasive method to detect cancer blood markers in blood samples. They offer real-time insights into tumor dynamics and treatment response. This technology holds potential for early detection and monitoring of cancer recurrence. Liquid biopsy. If you know about biopsy, which is done after your death to completely scan your entire body, the liquid biopsy is currently an emerging technology which is used uh, to enter a liquid into our body and uh, to search for anything related to cancer. This, if developed properly, may reduce a large treatment methods or large equipment to search for the cancers inside our body. This is being developed and researched on, and is also the one of the mostly anticipated technologies in cancer treatment. Advances in radiation therapy. Radiation therapy, as I talked about earlier, consists of using light or radiation or UV, IR, examples like that, to target the specific to burn out the tumor, etc., containing it. This is not as effective as chemotherapy or the targeted therapy and immunotherapy shot, which you talked about earlier. In this, the cancer may relapse at a higher possibility to relapse, and this requires continuous treatment and continuous sessions to do this, and the relapsing is also maybe possible. The most of the people go under the radiation therapy. Middle class people, this is the only available treatment method in cancer radiation. Others require too much of amount of money, uh, not not in the hands of many people. And yeah, coming to role of artificial intelligence in this treatment methods, artificial intelligence or AI is increasingly being used to analyze the medical imaging of pathology samples. AI algorithms can assist in diagnosing cancer or predicting treatment responses. These tools aim to enhance clinical decision making and streamline workflows in oncology. AI is using, as I talked about in the genetic personalized medicine, uh, using to analyze your genetic structure by using this. They are using this AI to approach different genetic samples and also different types of cancers to make different types of antibodies in by diagnosing the different antibodies response against the cancer cells and how they are affecting it and which has the maximum efficiency and the least strain on the human's body. They are constantly improving it uh, to make them a very usable work tools in oncology. And they're coming to oncology. Integrative oncology combines conventional treatments with complementary therapies to support patients' well-being. Approaches may include nutrition, exercise, acupuncture, and mindfulness practices. This goal is to improve quality of life and reduce treatment-related side effects. This is more like a healthy side profile for the all the treatment we are going through. Uh, Approaches like nutrition, exercise, acupuncture, and mindfulness. These are generally required to keep the patient healthy while not being affected with the treatments done, such as radiation, which take a toll on your strain or strain on your body. This may somewhat improve your health to fight against the cancer and also help in, in improving your immune system to fight against the cancer. And generally, every patient is recommended to have a good nutrition exercise in when he afflicted with any sort of disease. But yeah, these are generally recommended for people who are afflicted with cancer. Coming to challenges in cancer treatment, despite advancements, challenges like drug resistance and high costs of innovative therapies remain. Access to advanced treatments can vary significantly based on geographic and socio-economic factors, as I talked about earlier. Middle class people are not available, are not gonna get easily those high. They are high expensive treatment methods which they can't get. There are only few methods which they can afford for themselves. Ongoing clinical trials are critical to overcoming these challenges and improving patient outcomes. Yeah, there is being research done on these all these different factors and all these socio-economic factors to make sure the treatments available for everybody. There are being advancements being done such as vaccines, different sorts of vaccines for different sorts of diseases and etc etc. And but yeah, the cost is as high as always. So they are being done. The improvements are being done, and yeah, coming to the conclusion, the landscape of cancer treatment is continuously evolving. New methodologies and technologies, continued research and collaboration are essential for developing more effective and cancer therapies. As we move forward, patient-centered care and personalized approaches will be the key to improving cancer treatment outcomes. And yeah, there are being more treatments are done. There are more new methodologies, technologies, and there continue research and collaboration with different sorts of people, different sorts of professional experts from all over the world, develop the new effective treatments and effective systems to reduce the cancer. And also there are being therapies. There are also being many innovations in this too. And yeah, such that we can see that as we moving forward, there are and also these all approaches are taken in the cancer treatment outcomes. They may improve the cancer treatment. And yeah, thank you for listening to the presentation.